Texas children and the elderly are falling through the cracks when it comes to some life-saving benefits.
Becky Oliver says state workers are making some serious allegations.
When the Affordable Care Act rolled out, millions of people were now eligible for Medicaid, and applications soared. Now our state says that there is no backlog processing those applications, but state employees tell Fox 4 that delays and denials are putting our state's most vulnerable at risk.
Slow and easy. There you go.
I cannot stand. I cannot walk anymore.
At 77, Joan Mulcahy is all alone. No kids, no family in Texas. When her husband John died in January, she needed help immediately. She can't even get in and out of bed or go to the bathroom alone. She qualifies for state Medicaid, but getting that help proved to be nearly impossible.
It makes you feel like you're not worth the time nor the bother. And doggone it all, we're senior citizens. We have contributed. I know I have contributed. I know John has contributed, not only to the cities we've lived in, but to the state and to our country.
Mulcahy signed up for Medicaid in January, and her case should have been a top priority. But month after month, nothing. Not only was she burning through her only savings trying to pay for help, the care she got was sporadic at best.
If someone says to you, I'm not coming this weekend, what does that mean for you?
That means that you sit in your chair and you get a blanket, and it's unhealthy, unpleasant, scary.
Desperate, Mulcahy finally started calling Garland paramedics for help.
That's what you have to do when you have no one to show up to help you get out of bed.
How many times have you called the paramedics?
4.
Joan, she should not be in the position that she's in at all.
Amara Freeman is a caseworker at the Texas Department of Health and Human Services, which oversees Medicaid approval.
Her case should have been completed January 21st.
Freeman says there's a crisis in state government. The cases are piling up because so many people are now eligible for benefits through the Affordable Care Act. And Governor Perry did not take the expansion money from the feds.
It's tripled our caseloads, whereas maybe I was assigned 200 cases a month. Now it's at least 350 or more.
And what's happening is that cases are being delayed, even denied.
A lot of times some workers would just go in and try to clear those cases.
This former employee didn't want us to show her face.
The caseloads are ridiculous. There is no way that you're going to be able to pull a caseload of 15 to 20 interviews a day.
Internal notes show Mulcahy was calling in to check on her application, but the state was apparently doing nothing more than making note of her calls. On March 6th, it says client and spouse are over the income limit. That was 2 months after John died. After Fox 4 started making calls, Mulcahy was finally authorized for services in late April. The state says 60% of the cases in Texas are approved within 2 weeks. But according to these mid-June statistics, there are 97,000 pending cases statewide.
Okay.
A spokesman from HHS told us Mulcahy's case was not denied. It was just processed late because it was assigned to a worker who was out on leave.
This is part of the file to Texas Health and Human Services. Part of the file.
Oliver Rione went around in circles for months with HHS and his kids' health insurance.
Here I am with 3 children that are eligible for coverage and cannot get the coverage, and had a sick child during this process. A time to keep silence and a time to speak.
Rione says he worked 40 years, contributed to the system, but when he needed help, the state couldn't deliver. HHS told Fox Rione's case was actually processed on time, but got caught between the state and the vendor system that assigns kids to a health plan. After we contacted the state, the approval sailed through.
After trying for months, within a week I get some results. And I'm grateful. I'm grateful.
And to be treated like this like we're just something you can just toss around, is despicable.
Back in Garland, Joan Mulcahy's problems are just getting more complicated. Her home health care agency is now taking legal action, saying she owes them more than $3 grand for services she got while she was waiting on the state. Mulcahy lives on $750 a month.
It's a disgrace. It's an absolute disgrace. It really is.
Now, the state says it is investigating to determine why it took so long for Mulcahy to get services, even though she had 2 outside state caseworkers assigned to her. Mulcahy does not believe she should pay the price for the state's delays. We'll keep you posted. Becky Oliver, Fox 4 News.